Assembly chamber. Sound. 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 Assembly.
Good afternoon to all of you here. I want to say before I start more formal proceedings that I hope all of you have enjoyed your time so far today in Parliament Buildings. It was a very enjoyable opportunity earlier to meet with some of you prior to and during lunch, and what I said to some of you then informally, I'll repeat now, that I hope that everybody will be relaxed in a way today that they can enjoy today's proceedings. I know there's some very serious issues to address, but I think it's most important, first of all, that everybody's relaxed in where they are and comfortable, and all of us take that comfortable position as an opportunity to listen carefully to the comments being made. Can I let you know as well that as Deputy Speaker of the Northern Ireland Assembly, I really am pleased to welcome all of you officially to the Assembly Chamber for today's Older People's Parliament. I am delighted to be able to chair this debate and trust it provides you all with the platform to raise concerns and highlight key issues that impact and affect older people right across Northern Ireland. The Assembly makes laws for all of our citizens, and it is essential that everyone can have their say. Today's event is a way for you to do that, and I look forward to hearing what you have to say. Older people in Northern Ireland are important to our community and also to our economy. The fact that the Speaker has given special permission to use the Assembly Chamber today reflects how important it is for the Assembly to hear the lived experience of older people and their concerns in their own words. The issues affecting older people are as diverse as those facing other sections of our community: housing, health, poverty, transport, crime, and much more. I know that you will use your contributions today to highlight those and other issues also. In your sessions this morning that you've had the chance to engage with MLAs of different parties, then just before lunch you had the opportunity to hear from the Deputy First Minister, Emma Little-Pengelly MLA, and also from the Health Minister, Mike Nesbitt MLA. As you know, our debate today coincides with the consultation period for the programme for government. The Deputy First Minister and the Health Minister made clear this morning that they encourage you to express your views during this consultation period. I will ensure that a copy of the official report of today's debate is sent to the First Minister and the Deputy First Minister for their consideration as they consider a final programme for government. So this is a good opportunity to raise the issues at the Assembly today, but I also hope, as I said before there, that you also enjoy the day. Before we move to our formal proceedings, I would like to take the opportunity to invite Anne Watson, an advocate for older people and a key person involved in previous older people's parliaments, to briefly set out the background to this parliament. Anne, I call you.
Thank you all for coming today. I hope we'll have a great event and should leave with more knowledge and information than we came with. The organising of today's event has been supported by a consultative panel with members representing a range of older people's groups and organisations who work with older people across Northern Ireland. On behalf of the panel, I would like to thank the Deputy Speaker for presiding over this Parliament and allowing this event to take place in the Assembly Chamber. I'd also like to thank the MLAs who have came to meet us and listen to the debate. In recent weeks, the panel has been holding meetings to design the format of the Parliament, agree the issues to and nominate speakers with lived experience. A public survey was conducted to identify the key issues to be discussed during the Parliament, which received almost 1,700 responses. There are 9 priority issues identified from the survey. We're here today to highlight why those issues are important and what action needs to be taken in the programme for government. I would like to reflect on how Older People's Parliament builds on a long history of pensioners' Parliament events that many of us here today were involved in. The Pensioners' Parliament was an initiative of Age Sector Platform, and it started with a survey and a number of local events in spring 2011. Then 180 of us came together for 2 days in June 2011 to discuss the issues for older people and passing a total of 24 motions. We worked very hard. Participants had to commit to both days and sessions, and they lasted from 10 a.m. to 3 p.m. with lunch in between, always well received. We then took 3 motions to be debated in the Senate chamber, here in Parliament buildings in November 2011, where 60 of us attended and ministers responded to our demands. Age Sector Platform continued with the Pensioners' Parliament initiative for a decade, with AGNI then taking on the mantle and organising the last Pensioners' Parliament, which was held in September 2021. Organisations and individuals contributed to that event, from AGNI Consultative Forum, from Age Sector Networks, and from former members of Age Sector Platform and the National Pensioners Convention. It all was supported by the Commissioner for Older People. Pensioners have a strong voice through the Pensioners' Parliament. We hopefully make our mark and show that pensioners are people who should be listened to. We have always enjoyed our engagements with politicians. One MLA was what you would call one of the first victims. He sat on a platform of 4 MLAs, and we asked the questions. No one had prior knowledge as to what these questions were. When it was over, he said it was like being in a lion's den. He remarked that it was one of the toughest question sessions he had ever experienced. Over the years, we have covered many important issues affecting older people, and a lot of them are the same issues we need today. Would you believe that at the very first Pensioners' Parliament 13 years ago, one of the motions debated was about a cut to winter fuel payments? Isn't it sad that this issue is back on our agenda today? The issues covered at the last Pensioners' Parliament in 2021 was also sound familiar today. Reform of adult social care, access to health and care services, transport and getting around, equality legislation for older people, sustaining the community of age sector, staying connected, and much more. In recent years, older people have proven that we can change things when we stand up and have our voices heard. The proposal to take the Smart Pass away from 60 to 64 years was met with great opposition. People gathered on the street and here at Stormont to protest. We argued that older people and society in general need this scheme. Without free transport, many older people couldn't get out and might become housebound. The health consequences of this would put more pressure on the NHS. We won that argument and that proposal has not been scrapped. Let's see what we continue to achieve together today and in the future. Thank you.
Thank you for those comments and for setting context for today's debate. And I think at this juncture I should just say that I've known you and your work and determination for many years, and I pay tribute to you for that and for leading us today into our proceedings. Order, members, we now move to formal proceedings. The next item of business is a motion on the draft programme for government. Clerk, please read the motion.
that this Parliament expresses disappointment with the minimal mention of older people in the draft programme for government, calls on the Executive to place the rights of older people at the centre of the new programme to address issues such as health, housing, transport, loneliness, poverty and safety, and further calls on the Executive to include affirmative, measurable actions in the new programme that will meet the needs of all older people.
Thank you. And I call on Ivan Baxter, and you will have up to 5 minutes to speak.
Thank you, Mr. Deputy Speaker. As I say, my name is Ivan Baxter. I'm a member of the Belfast East Seniors Forum and the Greater Belfast Seniors Forum, and I've been asked to address the Older People's Parliament on the subject of equal access to appropriate healthcare services. This is a vast subject, Mr. Deputy Speaker, so in the time available I will only touch on 3 areas, and very superficially at that. In our forums, when the draft programme for government was published, we held discussions about the matters that affected folk most. Top of the list was trying to get a doctor's appointment at GP surgeries. Ringing the doctor's surgery early in the morning and then finding that all the slots are already taken is very stressful for older people. And if they do get through eventually, only to find they're 25th in the queue, that's almost as bad. If they're fortunate enough to get speaking to a receptionist, the usual response is that the doctor will ring them back sometime during the day. And waiting for a doctor's call is also stressful. What happens if they don't get it? What happens if they miss the call? Younger folk can deal with these situations much better than elderly people. And indeed it is rumoured that as far as younger people are concerned, if they don't get a doctor's appointment, then they simply go to the emergency department in the nearest hospital, thus adding to the queue there. And so we believe that a much easier and simpler way to make doctor's appointments should be devised, which would make life easier for older people. Secondly, we hear so often that getting discharged from hospital can be very stressful for older people. In many cases, there is a need for a care package to be put in place before the discharge. And this sometimes can take weeks. In the meantime, the older person is either bed blocking or they're transferred temporarily to a less acute hospital to wait, and this can be a long time away from home, and even in distance terms a long way. So there's therefore a need, Mr. Deputy Speaker, for a much more efficient arrangements for hospital discharges, which causes a little bit less stress for older patients. And the less stress, the better.
Will the member give way?
I will, yes, certainly.
David Jemison. Mr. Speaker, I wish to commend our health workers. They are working incredibly hard within very demanding circumstances. Through our older people's forums, our networks and word of mouth, I am aware of the excellent care once an older person gets to the point of treatment. Nurses are dedicated, doctors are thorough, hospital staff and cleaners are highly professional. These people are a credit to our health service. We should be valuing our health workers. But getting to the point of treatment is a nightmare for older people. Waiting lists are beyond concern. The healthcare system in Northern Ireland is forcing older people towards private care, which is unaffordable. How could we afford monthly healthcare insurance where we are already struggling to heat our homes and feed ourselves? We aren't earning any more and have no extra money. This year we have less money again now the winter fuel allowances have been taken away. We have already paid our taxes and national insurance throughout our lives, so why are the very services we've paid for now not being available to us, actually when we're starting to need them more? We have paid our way, now please can we have the health care that we should be entitled to?
Mr. Deputy Speaker, I'd just like to turn to my third point, and that was to raise the issue of age discrimination in the provision of health care. The COVID pandemic had a disproportionate effect on older people. In the first wave, 90% of the deaths were in older people, and the hospitals were finding it almost impossible to cope. A suggestion was actually made that perhaps folk over a certain age, say 70, should not be admitted to hospital since their chances of recovery were poor, and they were taking up a place in the hospital which could have been given to a younger person with a better chance of survival. Now, this course of action would have been unlawful in Great Britain. It was never followed, but it would not have been unlawful in Northern Ireland. The reason being is that here we have no law preventing age discrimination in goods, facilities and services. And this legislation is very badly needed here to ensure that such a horrific scenario never takes place.
Will the member please give way?
I will, certainly.
Mr. Deputy Speaker, this is a true story. This happened at a GP surgery in North Down, Ards, this year. An older man in his early 80s had a fall one evening at home and blacked out. He fell onto his face, came around and had hit his face very badly. The next day, the whole of his top half of his face, from his upper lip upwards, was purple and bruising. He went to his local GP practice, and the following morning he was clearly, visibly, badly injured, and unwitnessed fall with head injuries and possibly internal injuries. He was turned away by the people working at the reception and told to phone back the following day at 8:30. This is a GP practice that routinely had no emergency appointments left within minutes of the 8:30 phone line closing or opening. In spite of there being GPs and nursing staff present, no one would come to spend 2 minutes to look at this older person. He was told to go to A&E, which he did not do because many older people are frightened of A&E or don't want to because they will spend the whole day there. Wasn't this gentleman lucky that he did not have a bleed on his brain? What kind of GP service have we paid for when vulnerable, visual, badly injured older people are turned away? GPs are letting the older people in Northern Ireland down. We have lost all faith in them. Shame on GP service in Northern Ireland. Thank you, Deputy Speaker.
Thank you. And can I, before the Speaker continues, just have your name for the record, please?
Sorry, it's Godfrey Brockgad. I do apologise.
Thank you, Mr. Baxter.
Thank you, Mr. Speaker. I'd just like to finish off by talking briefly about the Department of Health's plans to cope with its budget, which will have a catastrophic effect on older people. There are 11 cost-saving measures being offered. 10 of them will affect older people, and 5 of them directly target older people. And these are reducing the support of the community voluntary sector's health promotion, which so many older people depend upon for information and other services. Reducing vaccinations, a bit of a surprise. How does this make sense when older people are being told to go and get their vaccination for their COVID and their winter fuel jab? Reducing domiciliary health care. A huge proportion of beneficiaries of domiciliary health care are older people. and reducing the number of acute care beds. Again, they are heavily used by older people. So these areas that have been offered by the Department for saving money are going to, again, disproportionately affect the older community. These plans will result in more older people turning up as more expensive cases. They will only make things worse and cost us a lot more money in the health budget. Mr. Deputy Speaker, there are many other issues relating to older people in this very wide area of health care and services, and I would urge the Executive to revisit the draft programme of government in the light of an expanding ageing population. Thank you.
Can I thank those who have spoken for getting our debate off to such a good start this afternoon. I now call on Norma Jeffers, and you will have up to 5 minutes.
My name is Norma Jeffers, and I'm representing the older people who responded to the consultation for the Older People's Parliament via Agenda, known as Age North Down and Ards. This is a charity whose purpose is to support and encourage all older people to live well, become active, engaged and influential members of the community. Ards and North Down had the highest return to the consultation, and the topic of transport and travel was identified as a top priority. For context, according to statistics published by NISRA from the 2021 census for Northern Ireland, the population increase from 2011 to 2021 was greatest in the older age groups. Those aged 65 or more increased by 24%, in other words, over 60,000 persons. The largest increase was in Ards and North Down, from 17.7% to 22.1%, and the area covers a sizable urban and rural demographic. Firstly, I would like to discuss the positives identified via the consultation. There are some excellent initiatives and services already in place. Pedestrianised areas were valued and should be increased. The Motability, Shop Mobility, mobility scooters, blue badge schemes were again highly valued. Free travel for older people, the Smart Pass, should continue in its current form. Airport priority boarding, air ambulance, hospital transport, community transport schemes were all acknowledged positively by our respondents. There are, however, gaps and challenges, and those I'd like to highlight today. First of all, I want to acknowledge and welcome the new central station and all its anticipated benefits. There are, however, other gaps, for example, connectivity improvements, and these need to be extended to rural areas such as hubs. On a practical level, there's a lack of well-covered and seated bus shelters, as is a gap within access and egress to bus stops. There's no point having the bus stops if you're risking life and limb to reach them. His respondents also talked about accessible, affordable and user-friendly public car parking facilities, and travel to our now not local bike branches in order to maintain financial independence and management. There's an impact to these transport challenges. For example, access to everyday activities such as health appointments, banks, shops, meeting family and friends, social activities, all of things we take for granted can have an impact on our social interventions, sense of isolation, mental health and well-being.
Will the member give way?
I will.
Thank you, Deputy Speaker. I am Adria Ann Brown, and I rise to highlight the need to implement a loneliness strategy in Northern Ireland, such as already exists in Scotland and in Wales. The negative effect of prolonged loneliness, especially upon older people, is regarded by health professionals as a public health issue. I commend the excellent services provided by Age North Down and Ards, known as Agenda, in supporting isolated elderly people. But I believe that a loneliness strategy, which all political parties supported in principle here in the Assembly on the 29th of April this year, should now be created and rolled out, mainstreamed, across all relevant government departments without delay, and recognised in their forward planning. Thank you.
Thank you. Recommendations from respondents. Very practical thing is information on what is available in a local area and Northern Ireland as a whole. We need ease of access to appropriate benefits to assist in transport costs, and we're calling for the establishment of the Older People's Parliament to continuously highlight, monitor and review progress on these issues. There also needs to be an implementation of an accessible transport strategy for older people. And there should be continuous consultation and engagement with those who plan transport policy and services, ensuring that older people have a valued voice. In conclusion, thank you for the opportunity to address the Older People's Parliament today. We believe the issues highlighted will lead to improvement to travel and transport for future generations and ensure accessibility, fairness and equality to all.
Thank you both. And I now call on Marion Cinnamon, and you will have up to 5 minutes to speak.
Thank you, Mr. Deputy Speaker. Good afternoon. I'm Marion Cinnamon from AGNI, and I'm going to speak about older people in relation to education and work. I first retired from full-time work in 2014 when I was 61. What I experienced, in common with a lot of older people, was living in a world that was getting smaller. I no longer had regular colleagues, and over the next few years, several of my close friends became ill and died, sadly a common experience in ageing, and my eyesight started to deteriorate. This scenario of living in a shrinking world is common to a lot of older people who can begin to feel lonely, unwanted, and that they have nothing to offer in life. I'm going to focus on two areas that can help older people make a positive contribution to society: education and work. There's no shortage of evidence to show that learning new things is beneficial to older people. As neurons in the brain die, new neurons can be formed to compensate for the loss. And this is alongside the obvious benefits of the joy of learning new things, the social aspects of being part of a class, and a sense of achievement that can be gained. The brain is a muscle that needs exercise to keep healthy, just like any other. The motivation to keep on learning may be different, and there may be less emphasis on career development, for example. Mr. Deputy Speaker, the provision of learning for older people at a local level through organisations such as U3A is to be welcomed and celebrated. I'm proud to have recently joined them. I have also benefited for many years from concessionary fees for courses at Queen's University and Crescent Arts Centre. Concessionary fees, however, does not necessarily mean affordable on a tight budget, and at times I've had to refrain from signing up for classes on cost grounds. Also, many older people depend on public transport, and some are not comfortable going out at night. I also want to mention access to higher education for older people. For some people, this may be the first opportunity to consider a university education. And for others, myself included, it may be the time that they can consider taking on that course that they always wanted to do just because they're interested. Support with fees for full-time higher education courses is not available for people over the age of 60. Happily, there is support available for part-time higher education courses, but only if at a higher level than the applicant has already obtained. My maths degree, never going to happen. In short, I would ask the Assembly to maintain awareness of the health and societal benefits of providing educational opportunities for older people at a range of levels, at a cost they can afford, at times they feel comfortable leaving their homes, and in locations they can access wherever they live. Moving on to the topic of older people and work, I personally still work part-time, but like lots of people whose income is just above eligibility for pension credit, it keeps me from poverty, and I dread the day when I will be no longer able to supplement my income in this way.
Will the member give way?
I will.
My name is Wilma Stewart from AGNI. One of the pieces of work I've become involved in was representing older people on the Anti-Poverty Strategy Co-Design Group. A position paper giving the group's recommendations on the development of an anti-poverty strategy for Northern Ireland was submitted. A number of calls were made by AGNI, one of them being support measures for older people of working age. No older person should be in poverty. A person's financial position upon retirement is linked to circumstances over a lifetime, their employment history, earning levels and time out of the labour market. Only too evident is the experience of the WASPI women who are fighting for redress against the increase in pension age imposed upon them with little warning. Recommendations included the strategy should consider the implications of an ageing workforce in Northern Ireland. There should be flexibility and support for changes in roles and support to gain skills across the age range. Data on working age should be collated and reported on to reflect rising state pension age. Mr Deputy Speaker, MLAs, I ask that the Northern Ireland Executive ensure addressing poverty in later life is identified as a priority in the programme for government. Thank you.
Hear, hear. With the raising of the state retirement age, more and more older people are having to work longer, whether they want to or not. Older people can bring a lifetime of knowledge and experience to the work environment. But in order to contribute to the workplace in a meaningful and satisfying way, some older people may need the right conditions and support to be in place. AGNI has researched this topic, and their Age at Work programme aims to address some of the issues older workers experience and to provide meaningful support. Many older people have declining levels of energy or other health needs, which may limit the roles they can undertake. It would be a great loss to society if employers were unable to benefit from their knowledge and experience because they were not willing or able to accommodate the older person's needs. Older people are as varied as any other age group. Some may want to work full-time for as long as possible. I opted for the flexibility of freelance work for a few years, and I can only work in the role that I do now because of the benefits to me of a 0 hours contract. If they're done away with, I'll have to find some other way to cope financially. Other people may want to start or continue to run their own business.
Will the member give way?
I will.
Thank you, Deputy Speaker. George Bell, to maybe supplement some of the excellent points that my colleagues have just made. Yes, we're living longer, healthier lives, and have the opportunity to think differently about working as we get older. As we've heard, AGNI have supported interventions such as designed to deliver what we call midlife career reviews to help workers to plan, to progress and prosper in later life. But this initiative also needs supportive leadership from government. Now, the last two UK governments have appointed business champions for older workers. And the current champion, Andy Briggs, was chair of Business in the Community Age at Work leadership team, promoting the benefits of older workers to employers and supporting them to hire and retain older workers. Now, the business champion is a voluntary, unpaid, non-political appointment, so I say that the time is ripe for this Assembly to appoint a business champion for older workers in Northern Ireland.
Thank you. Older people also contribute greatly through volunteering, and let's face it, if you had to pay us, you couldn't afford us. My own experience is that older age can be joyous and fulfilling because I'm lucky enough to remain active and involved in a range of activities. It is important that carrying out the programme for government, the Assembly maintains an awareness of the support needs of older people in relation to education and work to foster a happier, healthier and well-connected generation. Thank you, Mr Deputy Speaker.
And thank you and the others who have spoken. Before we move on, I just want to point out to members, I'm sure you'll join me in the appreciation that Claire Sugden, MLA, has also joined us here this afternoon to hear the debate. I now call on Valerie Cabain, and you will have up to 5 minutes to speak.
Thank you. I'm Valerie Cobain. I am the U3A trustee for Northern Ireland, and I'd like to focus today on loneliness and isolation. And thank you for giving me this opportunity to address a topic that touches the lives of many, but is often left in the shadows: loneliness and isolation. As people enter their golden years after decades of hard work and dedication, society paints a picture of leisure and relaxation, but for many, the reality is far from idyllic. Instead of peace, they often find themselves confronted with a quiet void, feeling disconnected and invisible. Loneliness, while a universal human experience, can be especially acute for those who are older. The reasons are many. It often means leaving behind the structure of a career, the companionship of colleagues, and the daily routine that gives life meaning. Friendships forged over years of work can drift apart, and we no longer see each other. As the days stretch on, it's easy for a sense of purpose to erode. Once central to a functioning of an organisation or community, they feel now as if they're simply on the sidelines, no longer needed or valued. This isolation is further compounded by the inevitable changes that come with ageing. I will.
My name is Mavis Turner, and I would like to endorse everything that Valerie has been saying. Thank you.
This isolation is further compounded by the inevitable changes that come with ageing. Health issues may make it more difficult to engage in social activities. Some people become housebound, and with limited mobility comes limited opportunity to see friends or participate in community events. And tragically, many face the loss of loved ones, whether it be a spouse, family members, or lifelong friends. These losses can only create emotional pain, but leave a gap in the social networks that they depend upon for companionship and support. What's particularly alarming is that loneliness is not just an emotional state. It is a serious public health concern. Studies have shown that chronic loneliness can lead to a higher risk of physical and mental health problems, including heart disease, depression, and cognitive decline. This paints a stark picture of how profound loneliness can affect the quality of life. So what can we do? As individuals and as a society, we must work to address this growing issue. First, we must encourage connection. Getting older does not mean stepping away from life, but stepping into a new chapter. Social programs, community centres and volunteer opportunities designed specifically can offer meaningful engagement. Such initiatives allow individuals to continue contributing to their skills and knowledge, keeping them mentally active and socially connected. Second, we need to leverage technology as a tool to combat isolation. For those unable to leave their homes, technology offers a vital lifeline. Video calls, social media, and lifelong communities can help older people to stay in touch with family, friends, and even new acquaintances. While technology can never replace face-to-face interaction, it can be a powerful supplement to maintain social bonds. Lastly, we must nurture a culture of inclusion. Families and communities should make a conscious effort to reach out to their older members, involving them in activities and ensuring that they feel valued and heard. Simple gestures, a phone call, a visit, an invitation to join a family gathering can make a world of difference. Loneliness and isolation are not inevitable. With awareness, understanding and action, we can ensure that older age is not a time for solitude, but a time for continued connection, fulfilment and joy. By addressing these challenges head-on, we can build a society where no one, regardless of age, has to face the quiet pain of loneliness alone. Thank you.
And thank you. I now call on Ivan Baxter, and you will have up to 5 minutes to speak.
Thank you, Mr. Deputy Speaker. Just to repeat that I'm a member of the Belfast East Seniors Forum and the Greater Belfast Seniors Forum, and I've been asked to speak to you about poverty amongst older people in Northern Ireland. And got my information, most of the statistics I have in this address are taken from government publications, and they can be easily verified, but I have used rounding just for convenience. So in Northern Ireland, about 1/5 of the population can be classified as older. This proportion of the population is growing and will reach about 1/4 in about 20 years' time. And of the present older people's population, about 1/4 are living in poverty, according to the latest figures from the Department of Communities. Now that works out round about 58,000 pensioners living in poverty, which is not exactly something we can be proud of. How has this come about? Well, to begin with, pensioners have suffered a number of hits in the comparatively recent years, beginning with the withdrawal of the TV licence, the free TV licence. Then the pension age was increased to save money, and now it is proposed to withdraw the winter fuel payments to all but the most needy. But the underlying cause is none of these. It is the fact that the UK pension is among the stingiest in the whole of the Western world. In a league table covering most European countries, if Britain was a football team, it would be relegated. So this is state-imposed poverty. Rising living and energy costs have made older people increasingly fearful and anxious. Many are living in damp, cold homes, washing in cold water, and afraid to use their cooker because of the price of electricity. Since COVID, 3 times as many pensioners are using food banks than before, and this will probably increase. Older folk, already vulnerable, will most certainly succumb to both stress and cold-related illnesses, putting great pressure on already overwhelmed health and social services. The government's plan to save money through their draconian treatment of older people will simply go up in smoke, and there will be no savings. It'll cost them. So what can be done to mitigate this situation? Well, in an ideal world, the restoration of the free TV licence and the cancellation of the withdrawal of the winter fuel payments would be a help. In addition, the linking of the lowest tax threshold to the triple lock would also be useful. But most of all, the raising of the basic state pension, which the vast majority of pensioners receive, it's around about £170 a week, to the same level as the new state pension, which only a minority of pensioners receive at the moment, and it's about £220 a week. That's £50 a week gap. If that was raised to the same level as the new state pension, it would solve a lot of problems, but there is no political will to do this.
Will the member give way?
I will.
Thomas Hines, Deputy Speaker. Raising the level of poverty among the elderly is really an issue in my generation, and we fear for the future generation of people coming into retirement age. We feel cheated and neglected when we return for years of hard work, paying tax, public contributions. Our pensions seem to be increasing shrinkingly, and benefits like the winter fuel removed. This will have a real dramatic consequences of the people over 60 having to choose between heating the home or eating a healthy meal, worsening loneliness and feeling dispersed. From talking to friends and neighbours, we are hearing of people only being able to heat one room in the house, not being able to give a warm meal because they are afraid to use the gas. People would spend their days in public buildings or public transport like the glider because they are warmer than their house. We are hearing of people isolating themselves shamefully. They are not being able to look after themselves properly because having to choose between the necessary dignity, independence, getting stripped away. My peers feel overlooked and left to their own devices. Most of us Most of us are no longer active members of the workforce, therefore we seem to be expendable. We would urge the government to look at the subtleties of making lives of the older generation easier and identified.
Thank you, Mr. Deputy Speaker. Pensioner poverty is a devolved issue. So, is there anything that could be done locally by our executive to help people in this province here? Well, the Department of Communities themselves estimate that with regard to pension credit, £1.1 million per week, £1.1 million per week is not being claimed in pension credit. Now, that's roundabout, and they believe that roundabout 26,000 older people could benefit from pension credit if only they claimed. So, what the department needs to do is mount a vigorous campaign to improve the take-up of this particular benefit substantially. That would make a big difference. Secondly, the Lone Pensioner Allowance, which provides a 20% discount to folk living alone of their rates, could be increased to 30%, give them a bit more breathing space. This is something a local administration could do. Thirdly, the executive could seek the extension of the Great Britain Warm Home Discount Scheme to Northern Ireland. This scheme provides £150 per annum discount off fuel bills to needy pensioners and is at no cost to the Treasury. It's paid for by the electricity companies, the energy companies themselves. Now, these measures will not entirely eliminate poverty, but isn't it better to do something than nothing?
Will the member give way?
I will.
My name is Joan Hayes. Who is going to pay for old age in the future so that older people are not living in poverty? I paid my taxes and national insurance, but now, how is the cost of the ageing society going to be covered? The number of older people is increasing, while the number of people of working age and paying tax is decreasing. In 2017, for every older person of pension age, there were 5 people of working age. Now, it's 4 people of working age. By 2040, it is predicted to be 3 people of working age, and by 2070, it is predicted there will be around 2 people of working age for every pensioner. Meanwhile, the cost of the ageing society is increasing. Increased numbers on state pension, increased housing costs, increased healthcare. The Northern Ireland Assembly has no strategy for coping with an ageing population. The executive is sleepwalking into an economic tsunami of the same size as the crisis in healthcare, childcare, and the environment. The programme for government needs a 10th priority to strategically plan properly for the impact of an ageing population. Thank you.
Right, Mr. Speaker, just to conclude, as I said earlier, older people are in the process of forming a greater proportion of the population. And as my colleague has said, I would urge the executive to rethink the draft programme of government, which hardly mentions older people, and set about creating a strategy for an ageing population covering all aspects of life. One of our colleagues is prone to use the phrase, "our today is your tomorrow." But wouldn't it be a very good thing, Mr. Deputy Speaker, if your tomorrow was better than our today? No, I doubt if I'll ever find out. Thank you.
And thank you. I now call on David Jamieson, and you will have up to 5 minutes to speak.
Thank you. Today I'm going to address the digital divide and bridging this gap for older adults. Older adults today are increasingly embracing technology, but they often face unique challenges in navigating the digital world. These challenges can lead to social isolation, limited access to information, and economic disadvantage. This talk will explore some of the specific issues facing older adults in the digital age and discuss some strategies for bridging these. Accessibility, which is a major hurdle. Many websites and applications are not designed with older adults in mind, making them difficult to use. Small fonts complicate navigation, lack of contrast can possess significant challenges for individuals with age-related vision impairments. Additionally, older adults may struggle with touchscreens and other modern technology that require fine motor skills. As time goes on, printed schedules and documents older people previously relied on are disappearing. Digital literacy, a growing need. Older adults sometimes have limited experience with computers and smartphones, making it difficult for them to learn these new technologies. This lack of digital literacy can hinder their ability to access online services, communicate with loved ones, and participate in online activities. Meanwhile, bank branches and other services are rapidly closing, reducing opportunities for those who have difficulty navigating online platforms. Social isolation. The digital divide can contribute to social isolation amongst older people. As younger generations become increasingly reliant on technology for social interaction, older adults who are unable to use digital tools are feeling disconnected and excluded. Economic disadvantage. The inability to use digital technologies can have economic consequences for older adults. Online banking, job applications, and government services often require significant digital skills, and those who are unable to access these resources can face financial hardship. Meanwhile, it is reported that millions of pounds go unclaimed, with people having difficulty getting online to apply for these benefits and then losing interest in finding other ways to submit claims. Protecting against scams. Scams are by far the biggest concern for older people. It is essential for older people to be aware of the risks of online scams and be able to take steps to protect themselves. This includes being sceptical of unsolicited calls, emails, or text, especially those asking for personal information or financial details. Additionally, older adults should avoid clicking on suspicious links or downloading attachments from unknown sources or responding to fake advertising on social media platforms.
Will the member give way?
I will.
Right, my name's Godfrey Brockgard, just in case I'm asked later. Mr. Deputy Speaker, technology and computers can indeed improve some aspects of life. I use email, internet, and my wife uses Facebook to be in contact with her daughter that lives overseas. But there are aspects of technology that are not in favour of older people. My bank branch closed for refurbishment recently, so I had to go online banking, which was okay. But some of my friends don't have computers. They live in villages where bank branches and post offices have closed. They don't want to travel into town, and towns are inconvenient and difficult, especially for the disabled. The shift away from people is a major challenge. Increasingly, I find it impossible to get to speak to a human. This is inconvenient when dealing with my electric or gas bill, but very concerning when I'm trying to get results for my medical tests. Recently, it took me weeks to get the results. Scams are a constant concern. I get phone calls and text messages, and recently had one saying, I have a parcel waiting delivery, but I needed to pay a fee to get it. I didn't bother with the parcel. Older people are increasingly the target of these scams. As the future becomes more digital, the Northern Ireland Assembly has to do more to protect older people from the more remote side of technology and from the very real risk of scams. Thank you, Deputy Speaker.
To put this somewhat more in context, in the last 13 months, there were 5,412 reports of fraud made to the PSNI, with reported total losses of approximately 23.1 million. Bridging the digital divide. In summary, to address the unique challenges faced by older people in the digital age, it is essential that we promote inclusive design, ensure that websites and applications are accessible to people of all ages and abilities, offer digital literacy training, provide tailored training programs to help older adults and others develop the skills they need to use technology effectively. Support digital inclusion activities, encourage programs that provide older adults and others with access to computers, smartphones and internet connectivity.
Will the member give way?
I will.
Thank you, Mr. Speaker. My name is Ruth Garvin. My colleagues have been highlighting many issues in regards to the difficulties of navigating the modern digital world. This is all very challenging to my peers. The cost of the broadband can be a real problem. If you're struggling to feed or heat yourself, how can you afford to pay for broadband? If you're just above the pension credit threshold, you lose out on all the broadband deals. While we cannot stop progress, we still need to be able to conduct our affairs and have access to services face-to-face. Places like bank branches need to stay open and allow more time and flexibility over the counter. Websites should never replace printed timetables for those who need them. Older people often give up because they can't remember all of the passwords. It's often too much. Scammers are directly targeting older people. Lonely older people are sitting ducks for scam callers, and I'm aware of many older people panicked into falling for scams through automated phone messages saying their bank account has been emptied. The executive needs to put in place measures at a devolved level to support older people who experience the more challenging aspects and harms of technology. Not all of us have family members who can help. Thank you, Mr. Speaker.
We also need to advocate for policies that address the digital divide, support policies that promote digital equity, and ensure that everyone has equal access to technology. Digital first should not equal digital only when designing services to be primarily accessed online. By addressing these issues, we can help everyone bridge the digital divide and enjoy the benefits of technology while minimising the risks of falling behind or falling victim to scams. Thank you.
Thank you. I now call on James Frizzell, and you will have up to 5 minutes to speak.
Mr. Deputy Speaker, my name is James Frizzell, and I'm privileged to be here today with Building Communities Resource Centre in Ballymoney. A warm, comfortable, safe and accessible home is a necessity for every older person. Demand for social housing is at a record high, whilst capacity is decreasing. There is a shortage of older people's accommodation across Northern Ireland. The profile of social housing is determined by the needs of an ageing population. This requires accommodating more people with mobility, hearing and/or visual restrictions. Effectively, housing an ageing population is a concern for elderly people, as evidenced by the consultation ahead of today. Some older people are living in homes that are not suitable for their needs, but have limited options to find more appropriate housing. Lack of adaptations for those with mobility difficulties, high cost of home repairs, and limited availability of assisted facilities in the area are issues. There have been researches and reports written about housing for older people. There have been developments, but why? 10 years on, are we still asking the same questions and examining the same policies and strategies with no clear action? Evidence highlights the impact that housing has on a person, including their health, due to factors such as heating and dampness, their financial capacity to repair and maintain the house, and inability to use part of the house because of factors such as disability and mobility. There are issues with regard to older people who are living in privately owned or rented housing where the support from statutory bodies is unavailable. When I lived alone and fell down the stairs twice, it wasn't an option for me to have adaptations and support to remain in my own home. We need to consider the impact of rural and urban issues on housing for older people. I have been talking to older people who feel that they are now in forgotten villages.
Give way.
Yes, I will.
My name is Gillian from BCRC in Ballymoney. In support of the member's statement, I would like to highlight the importance of considering the rural aspect of housing. People who have lived in a rural life often find it upsetting and distressing to move into a town. We need to take into account those who want the peace of the countryside. Let's be mindful of where people have lived, their lives. We need social and sheltered housing and care homes on the outskirts of towns. To support this, could family members fill some gap in the shortage of carers? A similar policy, similar to maternity leave for people who want to care for a loved one who live in social housing or with their family. Support would be needed from employers and a structure put in place which is agreed at government level. We can support our older family members with flexibility, support and training. Thank you.
This Parliament needs to recognise that the quality of accommodation in which a person lives is fundamental to quality of life. We call for Parliament to understand and acknowledge the accommodation needs, preferences and expectations of older people. Mr Deputy Speaker, we need to ensure that services, policies, initiatives and activities meet the needs of our ageing population. We call for the provision of available and accessible housing options. We need options, capacity and availability to accommodate older people being discharged from hospital with appropriate support and care packages. Enabling older people to remain in their own homes as long as it is viable and they wish it is core to personal independence. There should be interconnectedness between housing and health with reference to the way in which older people are supported to remain living at home. We need a stronger commitment to safeguarding older people in residential care homes, when this is the only remaining option left for some who have been left with no alternatives.
Mr Deputy Speaker, will the member give way?
Yeah.
My name is Morbeth, also from BCRC in Ballymoney. In support of the member's statement, I would like to highlight the importance of having care packages in place to enable older people to be discharged from hospital. There are too many cases where older people have had to stay for longer periods in hospital, bed blocking, due to lack of plans in place to support the transition home. I have personal experience of a 98-year-old gentleman who had a minor fall at home and had been in hospital for a very short time, being moved to a care accommodation at 11:45 p.m. This initiated an upsetting phone call from the hospital to his next of kin, another elderly person, in the middle of the night. People have had to be misplaced into temporary supported accommodation until packages are put in place. This impacts on their rehabilitation, recovery and deteriorates their mental health. Thank you for the intervention.
We need to take steps to address these challenges. Policy and strategy needs to identify measurable outcomes that can be achieved and are held to account. Mr. Deputy Speaker, we need to build examples of innovative, appropriate housing options in the villages and towns. This approach needs to be regional and encompass the statutory and community sectors to ensure a wider impact. When developing housing options for older people, we would appreciate consideration of the following: quality of life, health and well-being, isolation and loneliness, actual space and design, flexibility and adaptability, positive model of ageing. We need to be able to offer advice and engage older people in benefits checks. We need to raise awareness of support and alternatives available to older people. Information and advice needs to be available in varying formats to engage with the ageing population and not limited to online channels. There could be additional funding provided within the voluntary and community sector to support this. We need to ensure that throughout the development, design and implementation of strategies that we have full participation of older people with lived experience who can help shape, inform and improve services. This should be supported by a range of community-based initiatives that promote inclusion and participation. Mr. Deputy Speaker, we have a real opportunity to effect change and support older people in a tangible and meaningful way.
Thank you. I now call on Anne Watson, and you will have up to 5 minutes to speak.
Thank you. Thank you, Mr. Speaker. Deputy Speaker. Pensioners do not expect preferential treatment, but neither do we want discrimination. When we were young, we were told, work hard, pay your national insurance and taxes until you're 60, 65, and you'll reap the benefit when you're older. So much for that. We had COVID, we got over that. The new Labour government came along with great promises, but found a black hole with debt of billions that apparently no one else knew anything about. They had to fill this black hole and needed money. So who do you think they take it from first? They decide to cut the winter fuel payment, taking up to £300 from us, and no proper discussion about it. Pensioners need this money to keep the heating on. When you consider rising fuel costs and the loss of other cost of living payments, many pensioners are facing a shortfall of hundreds from the money we budget for the year. What next? Are we back to heat or eat? Pensioners looking at a bleak future. If you do not have heat, you get sick. If you do not have food, you get sick. So these cuts will have an impact on a health service that is already on the brink of falling apart. 262,000 older people might need additional treatment if winter fuel goes through, at a cost of £169 million. So much for filling the black hole. On top of the cuts to our essential living expenses, the Department of Health has released a draft budget that, by its own admission, will have adverse impacts on older people as an equality group. Cuts to staffing, cuts to inpatient beds, cuts to residential care home places, cuts to domiciliary care that will mean over 1 million fewer hours of domiciliary care delivered. These decisions leave us feeling that we don't matter and our needs are not a priority to government. Older people's rights are under threat. Our right to live healthy, dignified lives, to have our independence and to have equal access to the services we depend on. Where is the commitment to older people's rights? We are not seeing evidence that older people's rights will be protected in the programme for government. It is particularly upsetting that this programme for government has left out the issue of age discrimination, which had previously been included in 2011 and again in the New Decade New Approach Agreement of 2020. Now we have a new programme for government draft that does not make any commitment to bring forward a law against age discrimination when assessing goods, facilities and services. How much longer must we wait for the Northern Ireland Executive to follow through on a commitment that it made 14 years ago?
Will the member give way?
I will.
Thank you, Deputy Speaker. I'm Anne Murray from Age NI. The member has pointed to the many years since the Executive committed to age discrimination legislation. Would the member agree that older people in Northern Ireland are now in a much worse position than our counterparts in the UK and in Ireland? Recently, Age NI submitted evidence to an inquiry by the Committee for the Executive Office into gaps in equality law. This evidence focused on the disparity in age discrimination protections across these islands. In Great Britain, age discrimination in the delivery of goods, facilities and services has been prohibited since 2012. This was when the age regulations were added to the Equality Act. In Ireland, age discrimination protections were included when the Equal Status Acts were established in the year 2000 and also cover goods, facilities and services. I put it to the member that it is not acceptable for us in Northern Ireland to have weaker protection of our rights due to the failure of the Executive to bring forward legislation. Thank you.
I agree. Older people are at risk of discrimination in many areas of our day-to-day lives. Research has shown that we can experience age discrimination when assessing health services like cancer treatments, surgery or mental health therapies. Age NI's Lived Experience Report for 2023 revealed that 79% of older people think equal access to healthcare is absolutely essential. This was the top issue for the older people surveyed. Some survey participants reported that they felt sidelined, forgotten about, dismissed, and no longer important to the health service. Some said they felt they were not encouraged to seek treatment and that the pain they experienced was not treated seriously. Others said that staff could be condescending in their attitude, not give an older person the time they needed to make a decision, or make assumptions that an older person did not have the capacity to make a decision about their treatment and care. The Commissioner for Older People published a report on ageism this year that showed 49% of us have experienced ageist attitudes and behaviour. One way this can affect us is digital exclusion, when service providers are not willing to provide non-digital ways to access the services we need. When it comes to financial services like insurance and mortgages, older people can be shut out of the market or have your age used as justification for charging extortionate premiums.
Will the member give way?
I will.
Thank you, Deputy Speaker. George Bell, I want to try and aim at some examples that a lot of people here might relate to. One of the sore points for many of us are the additional hidden costs and restricted choice, particularly when maybe purchasing holiday essentials such as travel insurance and car hire. And this was highlighted in a Which report about 2 years ago. Older people have long been charged higher premium for their travel insurance. Now we recognise advancing age is a risk factor that can push up prices. However, Which obtained figures from moneysupermarket.com showing that since the pandemic, the amount older travellers are paying has risen disproportionately when compared to other groups. Which also found and reinforced many of the points that have been made here, that there's evidence of older travellers being penalised because of digital exclusion by airlines. Most airlines charge customers much more amending a booking by phone or check-in at airports. So without legal protection, older people in Northern Ireland will continue to face direct and indirect discrimination in goods and financial services. So I put it to you, Mr. Speaker, that is both shameful and unacceptable.
So, Mr. Deputy Speaker, I put it to this House that older people need better protection of our rights. We need strong laws against age discrimination. We need government to invest in the services and financial support that will allow us to live well in later life. 1 in 6 people are now aged 65 and over. By 2040, it will be 1 in 3 people. The Executive should take action to protect the rights of such a large proportion of the population. And I ask you, how many people who normally sit in this chamber will be affected by continuing absence of these rights? Thank you, Mr. Speaker.
That concludes this item of business. Can I extend to you my sincere thanks to all who have brought the Older People's Parliament to this Parliament building today. I also want to congratulate you all on the debate today. You have expressed your views very clearly, and it was a pleasure to listen to them from this chair. I know that today's debate will not be the end of you making your voices heard, but I hope you enjoyed the rare opportunity to do it here in the chamber. I will ensure that a copy of the official report of today's debate is sent to the First and Deputy First Minister. Moving to our next item of business, I would say order. We now have to formally close our proceedings in the normal way through the adjournment. The question is that the Older People's Parliament do now adjourn. The meeting is adjourned. Thank you all.
Assembly Chamber. Sound. Assembly Chamber. Sound. Assembly Chamber. Sound.